Question 1. While gathering instruments for a scheduled laparoscopic appendectomy in the sterile storage room, the technician consults a printed document to identify the exact surgical trays and consumable supplies required for this specific physician. What is this document? A. Case cart pull sheet. B. Bowie-Dick test log. C. Manufacturer instruction manual. D. Biological indicator incubator record. Correct answer A. Knowledge point explanation. Core rationale. The case cart pull sheet functions as a detailed recipe for the sterile processing technician. It provides a specific list of all sterile instruments, disposable supplies, and equipment needed for a particular surgeon and procedure, ensuring the operating room has everything required before the incision is made. Trap analysis. Option B is incorrect because a Bowie-Dick test log records the daily air removal test results for dynamic air removal steam sterilizers, not surgical case needs. It would be correct if the scenario involved a technician verifying the sterilizer function at 273 degrees Fahrenheit before running the first load of the day. Option C is incorrect because a manufacturer instruction manual details how to disassemble and clean a specific medical device, not what to pull for a surgery. It would be correct if the technician was reading how to physically dismantle a complex robotic arm in the decontamination sink. Option D is incorrect because a biological indicator incubator record documents the temperature and daily results of sterilization efficacy tests. It would be correct if the technician was logging a negative fluorescent reading after 24 hours of incubation. Concept extension. Pulling items accurately according to this sheet reduces operating room delays and ensures maximum patient safety during the procedure. Question 2. While vigorously brushing a heavily soiled orthopedic reamer in the decontamination area sink, the technician physically removes residual blood and human tissue. These human tissues are fundamentally constructed from which microscopic base units? A. Cells. B. Organs. C. Cytoplasms. D. Systems. Correct answer A. Knowledge point explanation. Core rationale. The cell is the most fundamental biological unit of all living organisms, including the human tissues that technicians must clean from surgical instruments. Millions of cells combine to form the tissues being scrubbed away in the sink. Trap analysis. Option B is incorrect because organs are macrostructures made up of various tissues, not the fundamental microscopic base unit. Option B would be correct if the question asked for the specific grouping of tissues functioning together, such as the human liver or heart. Option C is incorrect because cytoplasms are the jelly-like substance inside an individual cell, not the base unit itself. Option C would be correct if the scenario asked what specific cellular material surrounds the nucleus where the technician is applying enzymatic detergent to break down proteins. Option D is incorrect because systems are large groups of organs working together. Option D would be correct if the question asked about the entire digestive or respiratory tract that the endoscopes were used inside of. Concept extension. The biological hierarchy progresses from cells to tissues, then to organs, and finally to body systems. Question 3. A technician working at the decontamination window receives a soiled neurosurgical set covered in bone fragments. The dispatch slip indicates the surgeon just completed a procedure requiring a physical opening to be drilled and cut into the patient's skull. What is the medical term for this specific operation? A. Craniotomy. B. Craniectomy. C. Open reduction. D. Burr hole. Correct answer A. Knowledge point explanation. Core rationale. In medical terminology, the root word cranio refers to the skull, and the suffix otomy means making an incision or opening into something. A craniotomy is the surgical procedure of temporarily removing a bone flap to access the brain. Trap analysis. Option B is incorrect because the suffix ectomy means permanent surgical removal. Option B would be correct if the scenario specifically stated the surgeon permanently removed a portion of the skull without replacing it to relieve severe brain swelling. Option C is incorrect because open reduction involves physically opening the skin to realign fractured bones, not cutting into the skull. Option C would be correct if the technician was inspecting a heavy orthopedic set used to place titanium plates on a broken femur. Option D is incorrect because a burr hole is just a small drilled hole to relieve pressure, not a full bone flap removal. Option D would be correct if the set only contained a cranial perforator used to drill a single drainage opening. Concept extension. Technicians handling these sets must pay special attention to cranial perforators and suction tubes, which are highly prone to retaining bioburden. Question 4. After a large steam sterilizer completes its cycle at 270 degrees Fahrenheit, the technician moves the cooling cart to the sterile storage area. Which physical activity represents a major operational workflow component that the technician must perform in this specific zone? A. Unloading cooled instrument sets and shelving newly received sterile medical supplies. B. Disassembling multi-part laparoscopic instruments for sonic cleaning. C. Inserting biological indicators into challenge packs for load monitoring. D. Inspecting unsterilized box locks for residual bioburden debris. Correct answer A. Knowledge point explanation. Core rationale. The sterile storage area is a high-traffic hub where technicians must constantly unload properly cooled trays from sterilizer carts, receive fresh sterile stock from outside vendors, and carefully place these items onto designated wire shelving. Trap analysis. Option B is incorrect because physical disassembly and cleaning of soiled instruments strictly occurs in the decontamination area. It would be correct if the scenario asked what the technician was doing while standing in front of an ultrasonic cleaner sink. Option C is incorrect because preparing biological challenge packs physically occurs in the clean assembly and packaging area prior to sterilization. Option C would be correct if the technician was standing at a prep table placing a vial inside a stack of surgical towels. Option D is incorrect because inspecting unsterilized items for bioburden happens in the clean prep area under lighted magnification. Option D would be correct if the technician was seated at an assembly workstation checking a Kelly clamp before wrapping it. Concept extension. Sterile storage racks must maintain a distance of at least 8 to 10 inches from the floor and 18 inches below the sprinkler heads to ensure environmental compliance. Question 5. During the inspection of a heavy orthopedic trauma set in the clean assembly area, the technician picks up a periosteal elevator. To ensure the working tip is not damaged, the technician must understand that the surgeon utilizes this tool for which specific physical action during surgery? A. Lifting a thin layer of tissue to expose the underlying bone structure. B. Surgically excising a large portion of the patient's stomach. C. Cutting cleanly through the tough dermal skin layer. D. Extracting a diseased section of the thyroid gland. Correct answer A. Knowledge point explanation. Core rationale. The prefix peri means around, and the root osteal refers to bone. The periosteum is the fibrous membrane covering the bone, and an elevator is physically used by the surgeon to scrape and lift this tissue away to expose the bare bone for repair. Trap analysis. Option B is incorrect because excising a stomach is a gastrectomy procedure requiring major abdominal instruments. Option B would be correct if the technician was processing a major laparotomy tray containing large self-retaining retractors. Option C is incorrect because elevators are blunt or semi-sharp scraping tools, not skin-cutting tools. Option C would be correct if the technician was inspecting a surgical scalpel blade handle in a general surgery set. Option D is incorrect because extracting a thyroid is a thyroidectomy requiring delicate neck instruments. Option D would be correct if the technician was checking fine tissue forceps in a specialized neck surgery set. Concept extension. Checking the delicate edges of elevators for nicks, burrs, or dullness is a critical inspection step before assembling any orthopedic or neurosurgical tray. Question 6. While physically measuring and pouring enzymatic detergent into a 3-compartment decontamination sink for a contaminated loaner tray, the technician consults a microbiology chart. The chart describes a specific spherical microorganism that lacks flagella and cannot physically propel itself across the stainless steel instrument surface. Which microorganism fits this physical description? A. Cocci. B. Bacilli. C. Aerobic bacteria. D. Viruses. Correct answer A. Knowledge point explanation. Core rationale. In microbiology, cocci are spherical bacteria that do not possess flagella or cilia, rendering them completely incapable of independent physical movement across surfaces. Trap analysis. Option B is incorrect because bacilli are rod-shaped bacteria that often possess flagella, allowing them to swim and move actively. Option B would be correct if the chart described a rod-shaped organism capable of self-propulsion through residual blood. Option C is incorrect because aerobic bacteria refers to any bacteria needing oxygen to survive, not a specific physical shape or motility. Option C would be correct if the chart described a microbe that specifically requires an oxygen-rich environment on the surface of an instrument to reproduce. Option D is incorrect because viruses are much smaller infectious agents that require a living host cell to multiply, not spherical bacteria. Option D would be correct if the technician was reading about non-living particles that cause diseases like hepatitis B. Concept extension. Understanding bacterial morphology helps technicians realize why thorough mechanical friction is absolutely necessary to physically dislodge these stationary microbes from box locks and serrations. Question 7. The sterile storage technician is reviewing the operating room schedule for a busy Tuesday featuring 20 complex total joint replacements. To ensure maximum patient safety and prevent critical delays, when must the technician physically collect and stage the required heavy orthopedic sets onto the case carts? A. During the evening shift on Monday. B. Early Tuesday morning before the first incision. C. Exactly 48 hours prior to the scheduled start time. D. Precisely 2 hours before each individual operation. Correct answer A. Knowledge point explanation. Core rationale. Pulling surgical cases the day or evening before the scheduled procedure is the established industry standard. This practice provides adequate time to locate missing instruments, replace torn blue wraps, and sterilize backup trays without delaying the surgical schedule. Trap analysis. Option B is incorrect because utilizing a just-in-time pulling method on the morning of surgery creates immense pressure and leaves absolutely no buffer time to correct missing items. Option B would only be correct for a sudden, unexpected emergency trauma case entering the emergency room. Option C is incorrect because pulling carts 2 full days in advance consumes too much physical space in the sterile storage area and increases the risk of tampering. Option C would be correct if the facility had a specific quarantine protocol requiring implants to sit for 2 days pending biological indicator results, though pulling carts that early is not standard. Option D is incorrect because pulling 2 hours before surgery causes extreme physical rushing and delays if an item is missing. Option D would be correct if the technician was urgently retrieving a single dropped instrument for an operation already in progress. Concept extension. Staging carts the night before maximizes departmental efficiency by utilizing the typically quieter night shift for continuous assembly tasks. Question 8. A technician at the decontamination sink receives a heavily soiled tray containing a Gilly saw, heavy bone cutters, and large retractor blades. The surgical schedule indicates the patient just underwent a BKA procedure. What specific anatomical tissue removal did the surgeon perform? A. Severing and removing the lower extremity distal to the knee joint. B. Extracting the bilateral reproductive ovaries and fallopian tubes. C. Reconstructing a deteriorating femoral hip socket. D. Realigning a fractured femur without making a physical skin incision. Correct answer A. Knowledge point explanation. Core rationale. The medical abbreviation BKA translates to baloney amputation, which physically involves using heavy saws to cut through the tibia and fibula bones to remove the lower leg. Trap analysis. Option B is incorrect because removing the ovaries and tubes is a bilateral salpingo-oophorectomy. Option B would be correct if the abbreviation on the dispatch slip was BSO and the tray contained major abdominal retractors and long tissue forceps. Option C is incorrect because reconstructing a hip socket is a total hip arthroplasty requiring reamers and broaches. Option C would be correct if the surgical abbreviation was THA and the tray contained heavy mallet and acetabular reamers. Option D is incorrect because realigning a femur without an incision is a closed reduction. Option D would be correct if the patient was being treated in the emergency room with external splints and casting materials without surgical cutting. Concept extension. Amputation sets contain power equipment or manual wire saws that require meticulous brushing to remove embedded bone dust before steam sterilization. Question 9. While visually inspecting microneurosurgical instruments in the assembly area, the technician must understand the delicate anatomical structures these tools will touch. Which overarching anatomical network serves as the primary command hub processing signals and directing all physical movements? A. The central nervous system. B. The medulla oblongata. C. The cerebral cortex. D. The peripheral brainstem. Correct answer A. Knowledge point explanation. Core rationale. The central nervous system encompasses both the brain and the spinal cord, acting as the master control center that regulates every voluntary and involuntary function within the human body. Trap analysis. Option B is incorrect because the medulla is only a specific lower section of the brainstem controlling automated functions like breathing, not the entire overarching control system. Option B would be correct if the scenario asked for the specific brainstem component regulating involuntary heart rate and respiration. Option C is incorrect because the cerebral cortex is only the outer layer of the brain responsible for higher thought processes, not the entire central network. Option C would be correct if the scenario specifically asked about the gray matter surface where the surgeon was delicately removing a superficial tumor. Option D is incorrect because the peripheral nervous system branches out from the central system to the limbs, and peripheral brainstem is not a standard anatomical grouping. Option D would be correct if the technician was inspecting tools used on nerves running down the patient's arms or legs. Concept extension. Instruments used on the central nervous system carry the highest risk for transmitting prion diseases and require rigorous moisture-retaining transport and specialized cleaning protocols. Question 10. An instrument tracking computer displays the term hemiarthroplasty for an upcoming orthopedic trauma case. The technician must decipher this medical terminology to pull the correct total joint implants. In this specific linguistic structure, where does the modifying prefix component physically reside? A. Positioned immediately preceding the core anatomical root word. B. Located at the very end of the term to indicate the final surgical action. C. Inserted directly between two separate anatomical root structures. D. Placed directly after the operative suffix to alter the final meaning. Correct answer A. Knowledge point explanation. Core rationale. In medical terminology, a prefix is a foundational word element always placed at the very beginning of the word, directly in front of the root word, to alter or specify its meaning. In hemiarthroplasty, hemi is the prefix meaning half. Trap analysis. Option B is incorrect because the word element located at the end of the term to describe the action or condition is the suffix. Option B would be correct if the technician was trying to identify the placement of plasty, which means surgical repair. Option C is incorrect because the element joining two roots is a combining vowel, typically an O. Option C would be correct if the technician was identifying the O in osteochondritis linking bone and cartilage. Option D is incorrect because prefixes never come after the suffix. Option D would be correct if the question described a completely fictitious word structure violating all standard medical terminology rules. Concept extension. Mastering these word positions allows technicians to quickly decipher unfamiliar procedure names on pick lists and select the appropriate sterile trays without constantly calling the operating room. Question 11. while forcefully pushing a 250-pound case cart into the sterile storage elevator, the technician relies heavily on their muscular system. What are the primary physical functions of this specific anatomical network during this heavy labor? A. Generating internal body heat, physically assisting with skeletal movement, and continuously pumping blood throughout the body. B. Producing red blood cells and storing critical mineral deposits for bone strength. C. Regulating water loss through sweat glands and providing a protective physical barrier. D. Secreting chemical hormones directly into the bloodstream to regulate cellular metabolism. Correct answer A. Knowledge point explanation. Core rationale. The muscular system serves three main purposes, which are generating heat through contraction, facilitating body movement by pulling on bones, and pumping blood via the cardiac muscle of the heart. Trap analysis. Option B is incorrect because producing red blood cells and storing calcium minerals are primary functions of the skeletal system, not the muscular system. It would be correct if the scenario asked the technician to identify the internal physiological function of the femur bones they were assembling in an orthopedic trauma tray. Option C is incorrect because regulating water loss and providing a physical barrier are functions of the integumentary system. It would be correct if the technician was reading about the protective functions of the human skin while washing their hands. Option D is incorrect because secreting hormones is the function of the endocrine system. It would be correct if the scenario asked what system the thyroid gland belongs to while processing a thyroidectomy tray. Concept extension. Proper body mechanics utilize the large muscle groups of the legs rather than the back to prevent severe muscular strain when lifting heavy rigid containers. Question 12. While manually sorting bloody orthopedic clamps in the decontamination sink, the technician wears full personal protective equipment to shield against invisible microorganisms. Which comprehensive statement accurately describes the diverse biological realities of these microscopic entities? A. They inherently exist on human epidermal layers, possess the ability to decompose waste materials, and can actively synthesize harmful toxins. B. They are exclusively classified as disease-causing pathogens that require a living human host to survive and replicate. C. They remain completely dormant in dark environments and only multiply when exposed to direct ultraviolet radiation. D. They strictly measure over 10 micrometers in diameter and are easily visible without utilizing a microscope. Correct answer A. Knowledge point explanation. Core rationale. Microbes are incredibly diverse organisms that include harmless normal flora on the skin, useful environmental decomposers in sewage, and dangerous pathogens capable of producing deadly toxins. Trap analysis. Option B is incorrect because microbes include many beneficial organisms like normal flora and environmental decomposers, not just strictly disease-causing pathogens. It would be correct if the operating room specifically asked the technician to define the term pathogen after sending down a tray contaminated with methicillin-resistant Staphylococcus aureus. Option C is incorrect because ultraviolet radiation actually destroys most microbes, while dark, warm, and moist environments promote their growth. It would be correct if the scenario asked what specific environmental conditions effectively kill microorganisms inside a specialized pass-through UV disinfection cabinet. Option D is incorrect because microbes are microscopic and strictly require a microscope to be seen by the human eye. It would be correct if the technician was visually inspecting a macroparasite like a tapeworm recovered from a patient. Concept extension. Technicians must assume all surgical instruments are contaminated with the most dangerous toxin-producing microbes and process them using universal standard precautions. Question 13. While rapidly pulling an emergency cholecystectomy tray from the sterile storage racks after an urgent phone call, the technician relies on their medical terminology training to physically grab the correct items. In this high-pressure workplace situation, what is the primary operational purpose of the technician possessing a strong foundation in medical terminology? A. Comprehending exactly what clinical procedure is being performed to accurately and rapidly provide the correct surgical instruments. B. Memorizing complex Latin and French anatomical root words to pass annual facility competency exams. C. Interpreting the manufacturer instructions for use to determine the correct enzymatic dilution ratio for cleaning. D. Decreasing the overall surgical turnaround time by assisting the circulating nurse inside the sterile field. Correct answer A. Knowledge point explanation. Core rationale. The fundamental purpose of learning medical terminology in the sterile processing role is to facilitate clear, precise communication with clinical customers. Knowing that a cholecystectomy means gallbladder removal allows the technician to instantly locate and dispatch the correct laparoscopic tray. Trap analysis. Option B is incorrect because memorizing word roots is just a learning method, not the operational purpose on the department floor. It would be correct if the scenario asked about the study strategies a technician used while sitting in a classroom preparing for their certification exam. Option C is incorrect because manufacturer instructions for use dictate technical equipment processing steps, which rely on mechanical engineering terminology rather than clinical medical terminology. It would be correct if the scenario asked what documentation the technician must consult to find the correct water temperature and chemical dilution ratios for a newly purchased ultrasonic cleaner. Option D is incorrect because sterile processing technicians do not work inside the sterile field during an operation. It would be correct if the question described the physical duties of a certified surgical technologist scrubbed into the procedure. Concept extension. Misunderstanding medical terminology during emergency surgical requests can lead to dispatching the wrong equipment, causing life-threatening delays while the patient is under anesthesia. Question 14. While assembling a delicate ophthalmic surgical tray under a lighted magnification ring, the technician inspects micro scissors used for anterior chamber procedures. These specific instruments are frequently used near the patient pupil. What specific anatomical definition accurately describes this ocular structure? A. The adjustable circular opening located in the center of the iris that actively regulates the volume of light penetrating the eye. B. The highly vascularized middle membrane layer of the eyeball that provides essential oxygen to the retina. C. The tough opaque white outer fibrous layer that physically maintains the spherical shape of the entire eyeball. D. The pigmented muscular ring that gives the eye its distinct color and physically contracts to change the aperture size. Correct answer A. Knowledge point explanation. Core rationale. The pupil is anatomically defined as the circular dark opening in the center of the iris that physically dilates and constricts to control the amount of light entering the inner eye. Trap analysis. Option B is incorrect because the highly vascularized middle layer is the choroid. It would be correct if the technician was reading about the blood supply network of the eye while processing instruments for a retinal detachment repair. Option C is incorrect because the tough opaque white outer layer is the sclera. It would be correct if the scenario described the thick fibrous tissue the surgeon must cut through to access the inner eye structures. Option D is incorrect because the pigmented muscular ring is the iris, which is the structure that surrounds and controls the pupil, not the pupil itself. It would be correct if the scenario specifically asked the technician to identify the colored anatomical portion of the eye that the surgeon was repairing during an iridectomy procedure. Concept extension. Ophthalmic micro-instruments used near the pupil are incredibly fragile and must be thoroughly inspected for microscopic burrs that could tear this delicate ocular tissue. Question 15. A technician wearing heavy personal protective equipment in the decontamination area begins experiencing significant physical perspiration due to the 80° Fahrenheit ambient room temperature. Which specific anatomical organ contains the glandular structures responsible for generating and excreting this liquid? A. The skin. B. The liver. C. The kidneys. D. The pancreas. Correct answer A. Knowledge point explanation. Core rationale. The skin is the largest organ of the human body and contains millions of sudoriferous sweat glands responsible for thermal regulation through the process of perspiration. Trap analysis. Option B is incorrect because the liver is responsible for filtering blood and producing bile, not sweat. It would be correct if the technician was asked to identify the organ targeted during a hepatic lobectomy. Option C is incorrect because the kidneys filter blood to produce and excrete urine for internal waste management, not sweat for external thermal regulation. It would be correct if the scenario asked which anatomical organs were being bypassed when a technician processes dialyzer equipment for a renal failure patient. Option D is incorrect because the pancreas secretes digestive enzymes and insulin. It would be correct if the technician was processing a tray for a pancreatectomy and needed to know the primary function of the removed organ. Concept extension. Because the decontamination area generates intense heat and humidity from steam and hot water, facilities must maintain strict temperature controls between 60 and 62 degrees Fahrenheit to prevent severe technician heat exhaustion. Question 16. While physically unloading a sterile instrument cart in the public hospital hallway, a technician overhears a coworker loudly discussing the specific surgical details and name of a patient who just underwent a complex procedure. The technician immediately intervenes, knowing that strictly protecting this sensitive health information falls under which specific professional obligation mandated by federal regulations? A. Federal legal responsibilities. B. Standard hospital employability guidelines. C. Facility resource management protocols. D. General departmental workplace ethics. Correct answer A. Knowledge point explanation. Core rationale. Protecting patient health information is strictly governed by federal laws such as the Health Insurance Portability and Accountability Act. Breaching this confidentiality is not merely a moral failing but a direct violation of legal responsibilities that can result in severe financial penalties and termination. Trap analysis. Option B is incorrect because hospital employability guidelines deal with attendance and dress codes, not federal law. It would be correct if the technician was verbally warned for wearing heavily soiled hospital scrubs into the public cafeteria. Option C is incorrect because facility resource management protocols dictate how supplies are ordered and tracked. It would be correct if the technician was logging a damaged 10mm laparoscope into the computer system for repair routing. Option D is incorrect because while maintaining confidentiality is certainly ethical, the scenario specifically asks for the obligation mandated by federal regulations, which makes it a strict legal requirement. It would be correct if the scenario described a technician choosing to honestly report a torn blue wrap they accidentally caused, which is primarily a matter of personal integrity and ethics. Concept extension. Sterile processing technicians often have access to daily surgical schedules containing sensitive patient data, and this paperwork must be securely shredded rather than thrown into regular trash bins. Question 17. A technician working in the decontamination zone receives an insulated transport container holding contaminated neurosurgical instruments used on a patient suspected of having Creutzfeldt-Jakob disease. The technician immediately implements extended sterilization protocols because this specific disease is caused by highly resistant infectious agents physically composed of what biological material? A. Abnormally folded pathogenic proteins. B. Microscopic acid-fast microorganisms. C. Highly mutated respiratory viruses. D. Spore-forming gram-positive bacteria. Correct answer A. Knowledge point explanation. Core rationale. Prion are the infectious agents responsible for transmissible spongiform encephalopathies like Creutzfeldt-Jakob disease. They contain absolutely no genetic material and are entirely composed of abnormal, misfolded proteins that are extremely difficult to destroy using standard steam sterilization parameters. Trap analysis. Option B is incorrect because microscopic acid-fast microorganisms refer to mycobacteria like tuberculosis. It would be correct if the technician was wearing a fit-tested N95 respirator to process bronchoscopes from a patient with an active lung infection. Option C is incorrect because highly mutated respiratory viruses contain genetic material like RNA and cause illnesses like influenza. It would be correct if the scenario asked what specific infectious agent causes airborne seasonal flu outbreaks among healthcare workers. Option D is incorrect because prion are proteins, not living bacterial organisms that form spores. It would be correct if the technician was reviewing the biological challenge microorganism, Geobacillus stereothermophilus, used to test the daily efficacy of steam sterilizers. Concept extension. Instruments exposed to prion require specialized neurosurgical processing protocols, often including extended steam exposure times of 18 minutes at 273 degrees Fahrenheit in a pre-vacuum sterilizer. Question 18. While pulling sterile inventory for tomorrow operating room schedule, the technician spots a procedure listed as a herniorrhaphy and proceeds to gather a basic open surgery tray along with several packages of synthetic surgical mesh. The technician understands the surgeon will physically implant this mesh to correct what specific anatomical failure? A. A weakened muscle layer allowing internal organs to physically project through an unnatural opening. B. A completely severed deltoid muscle requiring extensive reconstructive suturing. C. A diseased section of skeletal muscle requiring physical extraction for laboratory biopsy. D. A severely torn fibrous fascia membrane physically covering a major leg muscle. Correct answer A. Knowledge point explanation. Core rationale. The medical root word hernia refers to a hernia, which is the abnormal protrusion of an organ through a defect in the muscle wall containing it. The suffix raphathy means surgical suturing or repair, meaning the surgeon will physically mend this muscular hole, frequently utilizing synthetic mesh for reinforcement. Trap analysis. Option B is incorrect because repairing a torn muscle is technically termed a myopathy, utilizing the root mo for muscle. It would be correct if the schedule listed a myopathy for a professional athlete suffering a catastrophic shoulder tear. Option C is incorrect because surgically extracting a piece of muscle is a muscle biopsy. It would be correct if the technician was inspecting a specialized needle biopsy instrument used to sample diseased muscle tissue. Option D is incorrect because cutting or repairing the fibrous fascia is a fasciotomy or fasciorrhaphy. It would be correct if the patient was suffering from severe compartment syndrome requiring the surgeon to slice open the tough membrane surrounding the leg muscles to relieve pressure. Concept extension. Identifying the specific procedure allows the sterile processing technician to accurately predict whether to pull laparoscopic trocars for a minimally invasive approach or large self-retaining retractors for an open repair. Question 19. The sterile processing front desk receives an urgent call from the emergency room requesting a fiberglass casting cart and traction splints for a patient undergoing a CR procedure on a fractured distal radius. The technician knows standard sterile surgical trays are completely unnecessary for this specific intervention because the physician will perform what exact physical action? A. Physically realigning the broken bone segments externally without making any surgical skin incisions. B. Surgically extracting a diseased portion of the enlarged prostate gland through the urethra. C. Creating a completely new vascular pathway to bypass a blocked coronary artery in the heart. D. Surgically removing the entire reproductive uterus through an abdominal incision. Correct answer A. Knowledge point explanation. Core rationale. The clinical abbreviation CR stands for closed reduction. The term closed indicates that the physician physically manipulates and resets the fractured bones strictly from the outside of the body, eliminating the need for scalpels, surgical incisions, or internally implanted orthopedic hardware. Trap analysis. Option B is incorrect because extracting prostate tissue via the urethra is abbreviated as TURP, or transurethral resection of the prostate. It would be correct if the technician was asked to assemble a urology tray containing a continuous flow resectoscope. Option C is incorrect because creating a new vascular pathway is a CABG or coronary artery bypass graft. It would be correct if the technician was urgently dispatching a cardiovascular open heart tray containing a sternal saw. Option D is incorrect because removing the uterus is a hysterectomy. It would be correct if the surgeon was performing a TAH or total abdominal hysterectomy requiring heavy Heine clamps. Concept extension. If the non-invasive closed reduction fails to adequately stabilize the fracture, the procedure will be converted to an ORIF, requiring the technician to urgently dispatch a sterilized orthopedic implant tray containing plates and bone screws. Question 20. While manually dosing a high-level disinfection basin for flexible endoscopes, the technician reads the chemical manufacturer efficacy label stating the solution effectively destroys all vegetative bacteria capable of causing human diseases. What is the overarching scientific classification for these specific disease-producing microorganisms? A. Pathogens. B. Gram-negative bacilli. C. Potentially infectious materials. D. Spore-forming gram-positive cocci. Correct answer A. Knowledge point explanation. Core rationale. In microbiology, a pathogen is definitively categorized as any distinct biological organism, including bacteria, viruses, fungi, or prion, that actively causes illness or disease within a host body. Trap analysis. Option B is incorrect because gram-negative bacilli is merely a structural shape and staining classification, and not all organisms within this category cause disease. It would be correct if the technician was reading a lab report identifying the specific pink staining, rod-shaped bacteria recovered from a contaminated cystoscope. Option C is incorrect because potentially infectious materials refers to blood or body fluids, not the microorganisms themselves. It would be correct if the technician was reviewing the OSHA bloodborne pathogens standard regarding the physical handling of bloody sponges. Option D is incorrect because gram-positive cocci is a structural classification for round, purple staining bacteria. It would be correct if the chart specifically described the microscopic appearance of Staphylococcus aureus causing a localized skin infection. Concept extension. The primary function of the entire sterile processing department is to physically remove and chemically destroy these pathogens to completely break the chain of infection before instruments are reused.